And it depends, you know, a 25 or a 30-year-old patient with very mild eyelid grooves, I can hit a home run in one treatment. Somebody who's got decent-sized lips that wants things a little bit bigger, I can hit a home run in one treatment with lips. Deep nasolabial folds, they need to be treated several times in my hands. Deep marionette grooves, several times. To get expansion of the midface and replacement of cheek volume, 2 to 3 treatments in most people. So it depends on the area, it depends on the patient, and I usually make this clear during the consultation. Roughly you're going to need, in my experience, 1 treatment or 2 treatments or 3 treatments so that there's no surprises, or as few surprises as possible. You're welcome.
What's the consultation fee cost?
As of the date of this today, the consultation fee is $75. And the $75 consultation fee is applied towards any procedure that's done. So if you
tomorrow.
Say again?
I said, what about tomorrow? You said today.
Oh, I'm not planning on changing that price, but there's, you know, everything that's being said today is going to be somewhere on the internet in time. And it's important for me to clarify that, mostly for my internet patients that may visualize this several years from now. I'm not planning on raising my price tomorrow.
Your prices include the facilities fees. I know you use this facility here, and you have an anesthesiologist, and you know.
Are you talking about for nose jobs?
I'm talking, yes. If you have to come here, I know for your office, that's the fees are what you specify. But if you have to come here, then there are facility fees.
That's correct. That's correct. You know, the only thing I'm going to say about that is when I'm dealing with a nose, if somebody's got a deviated septum, if somebody has a history of trauma, a lot of times I can work with their insurance to cover the anesthesia facility fee. If there's a deviated septum, an open reduction of a nasoseptal fracture, a lot of times with what I do on the nose, it's partly functional and partially cosmetic, and I utilize insurance whenever I can to cover anesthesia facility fee. Other procedures like upper eyelid that I commonly perform, upper eyelid blepharoplasty, getting rid of excessive upper eyelid skin, that's about a 1-hour operation. An anesthesia facility fee for 1 hour here at the ambulatory care center is $1,265 for a 1-hour procedure, $1,755 for a 2-hour procedure, $2,250 for a 3-hour procedure. And that's essentially what you're looking at, and rarely does an operation take me longer than 3 hours. Depends on the case. It depends on the case. Lower eyelids are a very, 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 very complicated entity, because unlike the upper eyelid, the lower eyelid is a free margin. So, you know, patients will come in to see me and they'll be like, "Doc, I want my lower eyelid to look like this," and they pull the skin real tight. What you have to understand is, since the lower eyelid is like a hammock, it's a free margin, if you put excessive tension on the skin to try to pull skin tight, it can pull down the eyelid margin, and you can get a rounding of the lower eyelid that can look like a bad nose job. It looks like a bad eyelid job. So, you know, part of the evaluation of a patient for blepharoplasty, both upper and lower eyelid, involves examining the tone of the eyelid, examining how much fat there is, how much skin there is. In general, if I can at all avoid operating on the lower eyelid, I avoid it. The most invasive operation I would feel comfortable performing on the lower eyelid is a conservative removal of eyelid fat through an incision on the inside of the lower eyelid and excising some of the excess skin with an external incision at the lash line that tends to heal very well. I don't do many of them. I do mostly upper eyelid surgery, and I manage most of my lower eyelids non-surgically. If somebody has a ton of skin in the lower eyelids that I'm not comfortable operating with, I have relationships with several oculoplastic surgeons in the area that I feel comfortable referring my patients to in a case that I might not feel comfortable with. I'm not a big fan of eyebrow lifting, and I was trained in it, and it's a fun operation. I know how to do an endoscopic brow lift. I have a problem with the operation. I think that most patients that get their eyebrows lifted tend to look chronically surprised, number one. I'm serious. They tend to look, their eyebrows, you know, you look at the after picture, and they look like they're staring at, you know, something surprising. I've found in my practice that to get delicate elevation to the eyebrows, I can do it fairly reproducibly with a little bit of Botox. And if you end up factoring the cost of Botox, let's say 2 to 3 times a year over 4 to 5 years, the cost of the brow lift and the Botox is similar. So I've just about abandoned offering brow lift surgery in my practice because I think it's unnecessary, can lead to a funny looking forehead, and you know, I prefer to do it with a needle. That's one doctor's take on it.
Okay.
Yes. Upper eyelid blepharoplasty, you're pretty much on house arrest for 5 days. 5 days after surgery, stitches come out. 7 days after surgery, we give you some fresh makeup. Diana's great at camouflaging any bruises. Most patients are able to resurface about 7 or 8 days after surgery with some fresh makeup and a refreshed look. About a week of downtime. My blepharoplasty scars have healed invisibly in everybody.
Oh, really?
Because the blepharoplasty scar is in, you can only see it when the eyes are closed. And in everybody that I've operated on, it heals as a very fine white line that is only visible if the eyes are closed like this. When the eyes are open, you can't see it. If there's a visible eyelid scar resulting from blepharoplasty while the eyes are open, I'm not really sure what you're referring to. All right, we good? Thank you so much for coming. It's really been a privilege. Thank you.